Welcome to MOH Essentials, indications for compression treatment in chronic venous disorders. These recommendations are based on recent guidelines and our consensus document. Compression therapy is a widespread treatment modality in chronic venous disorders, and the ESVS guideline state that it mainly consists of 4 different compression modalities: elastic compression stockings, elastic and inelastic bandages, adjustable compression devices, and intermittent pneumatic compression devices. In our consensus document, we recommend the use of compression stockings to alleviate venous symptoms in chronic venous disease and to improve venous severity and quality of life in venous patients. We also recommend the use of compression stockings to prevent and to reduce leg swelling in chronic venous disease and in healthy individuals at risk of leg swelling, for instance, after long-lasting standing and sitting. In the ESVS guidelines, compression treatment is recommended for symptomatic patients with chronic venous disease. The recommendation is for compression stockings with a pressure at the ankle region of at least 15 millimeters Hg. In chronic venous disease patients with edema, the recommendation is for compression stockings with 20 to 40 millimeters Hg. In the American guidelines, compression treatment is also indicated for patients with symptomatic varicose veins. In chronic venous insufficiency, compression treatment is indicated for the improvement of skin changes, for instance, eczema and pigmentation. And there is also an indication for the improvement of lipodermatosclerosis in patients with chronic venous disease. In the ESVS guidelines, compression treatment is recommended for lipodermatosclerosis and white atrophy with compression pressures of 20 to 40 millimeters Hg in the ankle region. Here you can see the summary of the ESVS guideline recommendations for conservative treatment of chronic venous disorders, starting with a compression pressure of 50 millimeter Hg in the ankle for the alleviation of venous symptoms, and going up to 20 to 40 millimeters Hg for edema, and also for skin changes, lipodermatosclerosis, and white atrophy. Thank you very much for listening. It was a pleasure to having you here.